Someone searches for Shockwave.
There you go.
They don't know what device they're looking for, but they hear it's good. And there's research that says it's good, but there's so many devices out there. But the device that really makes the difference is the high energy compared to low energy. This is a low energy device, and this is high energy. Now there's a big difference between the two. Have you had any experience with any of these yet?
I've tried the low energy machine before, which it provided temporary relief. It was, I could tell it was a very deep massage, so similar to the relief that I've gotten with the massage, and it did help, but I don't feel like it's actually gotten to the point of the pain.
Exactly. So tell us a little bit about the pain you're having and how we can help you.
So I've had ongoing pain in my left hip, and it's been going on for over a year. I've tried lots of things, but nothing's really resolved it, and it continues. It gets better for a short time, and then it continues to come back. So I've tried PRP injections, I've tried lidocaine shots. I've also been doing more recently, I've tried massage therapy and stretching, which has all helped, but it's been more temporary solutions.
Did you get range back?
No, I'm still really tight. I stretch, and then I have some range, and then 2 days later, I'm tight again.
Yes.
And as soon as I lay on my left hip, the next day it's bad. And I'm a runner, so I haven't been able to run as much as I used to, because that definitely aggravates
And
it.
you're saying bad pain?
Yeah, bad pain. I mean, it will be a sharp pain, and then it will start aching in my hip, my butt, and down my leg. Definitely limited my ability to do my activities that I'd like to do.
So you said you had PRP, you got results.
I did, but the problem was, I think it was short-lived. So it helped for a few months, but then for whatever reason, it just keeps coming back. And I don't know if I just accidentally lay on my side partially at night and that causes it. Okay, so there's something that's still flared up in there that we haven't resolved, I guess.
But high energy is much more effective as far as how much energy it can deliver and how deep it can deliver the energy into tissues. So we know that it can penetrate 7 to 9 centimeters. Some people have dramatic improvements in range of motion right after the procedure, where they can do things that they never were able to do even just before the procedure. Yeah, so it actually concentrates the energy into a single point inside the tissues, and it can be used to help patients avoid surgery in some cases. It goes in there, it breaks up calcifications, helps push out inflammatory mediators like prostaglandins, leukotrienes, tumor necrosis factor, all those technical terms for inflammation chemicals that can be pushed out by the machine. And then if you have scar tissue, it will sort of break up scar tissue and it'll help you improve range of motion and also restore range of motion. We're going to show high energy procedure on her hip. She's never had this done before, so we give you an idea, from start to finish, what you would expect. So the healing, a lot of the healing takes place in 12 weeks, but it will continue to heal up to 8 months.
Wow.
And over the course of time, you'll have new blood flow by forming new blood vessels, and it'll slowly sort of remodel back to the way it should, in a way. So it's a rejuvenating type of treatment.
How's it feeling now?
I feel like it will hurt, and then once it's in the same spot for a while, I feel some relief.
That's exactly right.
And then when you move the machine to a different spot, it starts hurting, where I can feel my leg shaking. But then that pain is reduced after a couple minutes. Yeah, I mean, there's no way I could have done this before the video. I mean, I couldn't even get to my foot to bring it up.
So you know what I'm trying to get across? Remember when low energy got you?
Yeah.
Could you do that before with low energy?
No, it didn't change my range of motion.
Low energy is not able to get what this high energy machine got.
Right.
And you have a complex case, really. That's something that we would have to approach pretty much here. I've said it. I'm already good. I'm just trying to kill that low energy machine. Because so many people go after that. Mm-hmm. And you get what you got from it, and you're really not satisfied, but you feel like some change happened.
Yeah, you feel an improvement for sure. I liked it. It's almost like a deep tissue massage where you get that relief. It feels good, but not a permanent change.
It's not able to repair it. This is the true orthopedic modality.
I see.
That is some machine that they created afterwards, basically for ED, and it's very effective for ED.
So show us how much you're able to move before and after, like if you could just show us.
So my range of motion prior to coming in today, I could get up to here and then I'd have to use like a rope, which, you know, I can use that to then stretch up, and I could barely get it up. But right now, after the procedure, I don't need the rope, and I'm at 90 degrees, which I couldn't have done. And I feel like I could probably even stretch it.
Can you
a little
rotate
bit
out?
further.
Yeah.
Yeah, which I couldn't do
Couldn't
this.
do that, right,
Same thing. I had to use a rope
Right,
because there's no way I could force it into that position.
Sure, but now you're just able to like
Yeah.
move into that
Yeah, and
position.
even going this way to stretch.
And here's the thing about this:
Across.
6 to 8 months is the healing, and it just gets better and better and better and better. Some people experience, like he was saying, a lot more pain than they had when they came in. You're not one of those patients. You're seeing that immediate relief.
Yeah,
Do you have any
for
other
sure.
things that bother you?
Good. That was amazing.
Isn't it
I mean,
amazing?